The following is a presentation of the Canadian Centre for Diversity and Inclusion. All content presented is the exclusive intellectual property of CCDI. Any sharing, reproduction, or use of this material or content requires the express written permission of CCDI. Should you wish to use this content in any way, please contact Michael Bach, founder and CEO, via email at michael.bach@ccdi.ca. Thank you.
Hello, and thank you for joining us today for CCDI's webinar, The Intersection of Race, Mental Health, and Stigma in the Age of COVID-19. Here are a few of our upcoming webinars that you're welcome to attend. Our webinars until the end of May are free, so we hope to see you at a few more webinars this month. You can register for them at ccdi.ca. Just a quick disclaimer before we get started here. The information contained in this presentation reflects CCDI's knowledge and experience, but it does not constitute a recipe that can be applied equally to all organizations. The presentation and related materials do not constitute rendering of legal, consulting, or other professional services of any kind. CCDI is not liable for any claims, losses, or damages of any kind arising out of or in any way related to the information provided in these webinars. Opinions expressed by participants are their own and not representative of CCDI. So thank you for joining us. My name is Mackenzie. I will be moderating today's webinar, and Anne-Marie, our Senior Director of Knowledge Solutions and Learning, will be facilitating. Just a quick few notes about the platform itself. You'll notice on the top right side of your screen, there's a full screen button. Feel free to click it if you'd like to view this webinar in full screen mode. You can hover over the icon to go back to the viewing of the Q&A chat box and captions at any point. Please note that today's webinar is being recorded and accessible to employer partners on our knowledge repository online. Everyone's mics have been muted so we can hear Anne-Marie clearly throughout today's webinar. Audio connection. If you are having trouble hearing us, please make sure you click on audio on the top side of your screen or communicate, and you'll be able to check your audio connection there. Captions. Closed captions have been made available to you today. They will be under the multimedia header on the right-hand side of your screen. You can change the font size of your text at any point for better accessibility throughout today's webinar. We also have a Q&A box that's open for you. If you have any questions throughout today's webinar, please feel free to drop them in there. Your questions will remain anonymous. Only Anne-Marie and myself can see them, so please feel free to ask your questions. We will be answering your questions at the end of today's webinar, and we'll go into a little more detail about that near the end. With that, I'm going to hand things over to Anne-Marie.
Thank you very much, Mackenzie, and good morning or good afternoon, everyone, depending on where you're located in Canada. I'm really pleased to be able to present to you a webinar on a very timely topic, which is the intersection of race, mental health, and stigma in the age of COVID-19. So let's talk about this webinar. The purpose is to examine the compounding mental health and workplace impacts of COVID-19 towards diverse employees. And today I'm going to put a lot of focus on individuals of East Asian descent, as you may have seen from all of the news and what's happening on social media. But I also wanted to take this opportunity to bring some awareness with regards to the COVID impact also on people of Indigenous backgrounds. And the webinar will include discussions around things that we should consider in terms of opportunities, responsibilities, and tips that employers and organizations can consider to reduce race-based microaggressions and mental health stigma targeted towards diverse employees, clients, and stakeholders. And I really wanted to say that this webinar came about because I was observing the rising anti-Asian sentiment that was starting to really brew over the last couple of months with this pandemic. And it has become even more apparent in our social media and the work that I have seen and witnessed that is driven by the community level from various Asian Canadian groups that I have been in touch with. And from this experience, I could see that there was some real deep concern about the state of exclusion, racism, and stigma and fear that is currently being faced by members of the East Asian community across Canada. So I also want to take this opportunity to highlight some concerns faced by Indigenous peoples for us to keep top of mind as we go through this pandemic period of isolation and restrictions and the impact that those have. In terms of our learning objective, first of all, setting the stage, understanding the current situation, and then really talking about what does that mean in terms of impacts at the individual, community, and workplace levels, and then exploring actions that we can take to reduce race-based microaggressions and mental health stigma. So a little bit about myself. I do have over 20 years of experience in diversity and inclusion, and I actually studied a lot of this work at the community level, working with newcomers, working with visible minority communities in Calgary, working with Vietnamese youth and women across Canada. And now I'm also involved in different networks such as the Canadian Race Relations Foundation, Asian Professional Networks, as well as capacity building types of networks. And of course, with all of our employer partners and clients of CCDI, also with employer networks. So there's a real deep appreciation, I think, for the lived experiences of various members of our society through the experience that I have, and realizing that, not everyone has the same privileges and opportunities, and that many folks experience some very systemic barriers to inclusion that can be manifested in, things like healthcare, education, employment, and even civic participation. And so let's unpack some of that as it relates to mental health, race, and COVID-19. I'd like to start off by asking you a question. So the first layer here that we're going to be talking about is mental health. So using your chat box, and if you don't have it open right now, you can click that little bubble icon at the bottom of your screen to open your chat box. And my question to you is, what have you seen in the news regarding mental health issues related to COVID-19? Okay, so think about the mental health issues. What are some of the issues that you have seen? So we're getting some comments in both the Q&A and the chat box. So here we go. Anxiety, isolation, depression and stress, absolutely. Loneliness, rates of suicides going up, pandemic burnout, increased awareness of mental health illness around isolation. Yeah, it's really taking a toll on everyone's mental health. A lack of support for people with difficult conditions. Really, it's so taxing on our current support system, that's for sure. We're not prepared for this. Concern for those who are alone. Yes, violence against women in the home. Absolutely. There's a higher number of domestic violence. People of color being affected. A lot of them are frontline workers, and they don't necessarily get the information they require for the safety. Students expressing boredom, and actually, yes, boredom, anxiety about their future education, about the impact it has, their ability to even find summer employment to pay for their tuition fees in the fall, lack of connections. Lots and lots of issues are happening around anxiety, uncertainty, stress, depression, lack of control over one's life and the life of a loved one. Thank you so much for that. And yes, substance abuse, like use of alcohol and drugs to cope with the situation. That's right. So really mental health is affecting each and every one of us. We can even say to some extent that many of us experience some level of trauma because of this pandemic. And even before the pandemic took place, if you look at this data from 2017 from the Canadian Survey on Disability, you can see that 7.3% of Canadians aged 15 and older indicated in 2017 that they are having mental health related disability. That's over 2 million Canadians, and that's before the pandemic. So we can imagine how much more this pandemic is affecting the mental health of Canadians today. It's not 2 million anymore. It's probably double that, if not more. And I'd like to just share a few images that have been put together by healthyplace.com to help create awareness around mental health and to speak about that a little bit. So this first one here is you keep a lot to yourself because it's difficult to find people who understand. And this really to me speaks to all the fears and anxiety that we talked about earlier in the previous questions, but it's tied to being stigmatized for having those fears. That's often attached to, these mental health challenges that we experience. And after time, it's like if you can't see it, it's really hard to prove. And so the first challenge we have is really, can I share this with other people? Will people really understand what I'm going through? And this one says, I never believed in mental health until it happened to me. And I think for those of us who are not part of the 2 million Canadians who have self-disclosed mental health issues, this COVID situation may suddenly have created a higher level of empathy, relatedness, and understanding for the people who are experiencing mental health, because some of us are now experiencing it ourselves, right? And we can see how that is being manifested in a variety of ways, such as, lack of sleep, bodily tension, headaches, worries, depressions, anxiety, fear of what may happen into the future, like losing my job, losing my home, inability to pay the bills, fearing for the health and safety of our loved ones, and people maybe that we know who are essential workers and what's going to happen to them when they come home to us every night. And so this pandemic is really providing us an opportunity to put ourselves in the shoes of those with mental health impact, because now this is also happening to us. And this disease comes with a package, shame. When any other part of your body gets sick, you get sympathy. And this is so true because many times, we've heard stories of individuals with invisible health issues and disabilities who just, feel like they don't get the understanding and the sympathy that somebody who may have, cancer or broke their leg or have a physical disability may get. And so this is something for us to really be able to understand. And I really hope that, this pandemic is really providing us with a greater sense of empathy for individuals with mental health issues. So now, adding the layer of race to mental health, let me ask you the next question. What have you seen in the news regarding incidents of racism related to COVID-19? So once again, you can use your chat box for your answers. Yeah, Donald J. Trump is the first answer. Yes, absolutely. So our political leaders can be a great source of the friction and the tension that happens. Brian Adams, yes, another one. Anyone with a high profile status, one of those social media influencers, can really provide us with, they can really provide, more ammunition for those people who are racist, so that they say, hey, if my leader can say that, maybe I can say it too. Vandalism of homes, being physically harassed, increased violence towards Asian Canadians across Canada, spikes of anti-racism violence, both physical and verbal. Yes, restrictions of Indigenous ceremonies triggering historical trauma of Indigenous people. Absolutely, yes. These rules that are being put in place have very different impacts on different people. And Indigenous people are certainly not immune to that. Social media rants. Yes, how easy it is to hide behind social media to start ranting. Somebody said there's so many things, it's so awful. Being spat at, xenophobia, less support available for racialized people. Absolutely. Increase in negative comments on how Indigenous Canadians do not deserve the additional support being given to them by the government. Yes, absolutely. Lots and lots of wrong information in the social media, lots of fear, lots of violence in words, in deeds, in assaults to property and to people. And one more here. I have never seen in the news people rejecting Chinese people because the virus is coming from China. Yes, thank you so much. I think that you've really, hit the nail on the head in terms of the depth and the breadth of comments in the news with regards to racism related to COVID-19. I think we are in very scary time at this point. And it's really important to take some time to unpack this and reflect on what this all means for us and for our Canadian society and workplace. So here are some examples that I want to share with you. This one is in Markham, Ontario. And this is a city of over 300,000 people, 70% of which are visible minorities. And this young lady here said, she was naive, she was wrong. She thought that she could just go to the store to get some eggs, and yet she left angry, and she had tears in her eyes because a white woman said, "Get away from me, get out of here, you Chinese, get away from me." And she was literally screaming at this young lady for being in the store. And what I find so interesting is when this lady said, "Are you ashamed of yourself for being so blatantly racist?" the white woman said, "I am scared, okay? I am scared for myself and I am scared for my family. Stay away from me, don't come near me." So this really speaks to, the fear that also people who are not Asian have towards Asian people. And this fear is often irrational, right? If you do your research, if you really understand that this virus does not discriminate and everybody gets it, there shouldn't be so much focus on only Asian actually having the virus and spreading it out to other people. So this was a very sad incident. And then in Vancouver, for those of you who have followed the news or live there, there is such an increase in vandalism and assaults of people of Chinese Canadian background or East Asian background who look Chinese. Like the Chinese Cultural Center of Greater Vancouver has been the target of racist graffiti and vandalism linked to the COVID-19 pandemic. And some of the messages were already erased, but when the news got there, they still saw the message that says "kill all" in red and white. And another message said, "let's put a stop to blank coming to Canada and drive them out of Canada." And the police actually said that, in 2019, there were 12 hate crimes in Vancouver against Asians. But as of the end of April 2020, there were already 9 hate crimes reported against Asian. And since then, there have been more. And here are examples of more. A Caucasian man assaulted a 92-year-old Asian man with dementia and kicked him out of the store. An Asian woman was punched in the face at the bus stop. And a woman was grabbed and kicked by a Caucasian man and this woman was defending 2 other Asian women that the man was insulting. So not only are Asian Canadians being assaulted, but people who are defending them are also being attacked as well during this period. And this example here really hits really close to home for me because this is happening in Brooks in Alberta. And we have found that in a very short period, over 2,000 workers who work at this plant here, actually about 1,000 of them got infected with COVID-19. And a high percentage of those workers are actually racialized workers, including temporary foreign workers and newcomers. And as of May 12, we have experienced 3 deaths, and they are of Mexican, Vietnamese, and Filipino background. And I think this is very telling. And as you do a deeper dive into, the story of these meat processing plants and the story of these workers, you will find that there has been a lot of misinformation, a lack of regulation, a lack of care for these workers. And for a lot of them, especially the temporary foreign workers, their employment and their status to stay in Canada is actually tied to their current job. And so it's really hard on them. If they lose their job, they would lose their ability to also stay in Canada. So we actually have a webinar coming up on May 28th, which will also be free of charge, where I have invited Action Dignity to come and speak about this. And this grassroots community organization in Calgary actually has been working directly with the workers of these meat processing plants and their families to support them. And so if you want to hear more about the stories on the ground and what's happening there in terms of considerations for workplaces, tune in on May 28th to find out more. And of course, many of you have mentioned this as well, the rising anti-Asian sentiment on social media is ongoing, right? So there are an increasing number of newspapers that are actually calling this virus the China virus or the Wuhan virus. And so putting the blame, on China and certainly adding fuel to the fire in terms of stigmatizing Chinese Canadians even more. Attacks on Dr. Theresa Tam, who for the most part said probably 95% of the same thing as many other healthcare leaders across Canada, but she was singled out consistently because of her ethnic background. And of course, one of you mentioned earlier, Bryan Adams, a music icon and star in Canada, who also made very derogatory remarks towards Chinese Canadians through his comments about bat eating and the disease being spread as a result of that. So what's happening in terms of impact? Let's unpack that a little bit more as well. A lot of work actually has been happening in Montreal with regards to a better understanding of the communities that are being impacted by COVID-19. And there's a very significant death toll in Montreal relative to the rest of Quebec. And for the people who are working on the ground, like community organizer Narges Mustafa, she indicated, that in places like Montreal North or Côte des Neiges, the hardest hit communities tend to be communities with poorer neighborhoods, with racialized neighborhoods, neighborhoods that have a lack of health services, inadequate transit access, and people living in crowded apartments. So the rules and regulations about, staying at home and not going to work is obviously much more challenging for people who rely on basic income to even pay the bills and survive and buy food for their family. The idea of physical distancing can be increasingly challenging for people living in crowded apartments. So this has been a real challenge for communities as identified in Montreal, but of course this can be also expanded to all of the communities across Canada in terms of the impact of COVID-19. And in terms of the impacts on Indigenous peoples, I mean, there's a lot of things happening there as well, and I just wanted to highlight a few things here. The higher proportion of Indigenous people who already have pre-existing health issues is being compounded by COVID-19, right? Because as we know, those with pre-existing health conditions are more likely to suffer from the harsher effects of COVID-19 health-wise. Living in substandard and overcrowded housing also cause greater rates of infection to COVID-19. Lack of access to clean drinking water and medical services, especially for those who are on reserve. And the social distancing and Indigenous approaches to relying on familial and community supports and maintaining their culture and their traditions, like the sweat lodge or like the ceremonies that one of our participants mentioned earlier. You know, these restrictions really have a difficult impact, a negative impact on the traditions, the cultures, the way of life of Indigenous people. And one of the things that I also wanted to highlight here is I remember seeing the federal government's approach to, trying to use isolation tents and temporary shelters to deal with COVID outbreaks in Indigenous communities. And when this came out, I remember that there was still snow on the ground, and it was still really cold, and in some places, very frigid temperatures. And actually in May, across Canada, we still have places where it snows a lot. And it's the question of, would the tents and the temporary shelter provide the safety that Indigenous people need to have in order to have that isolation that we need to prevent the spread of disease. So these are really difficult conversations that we need to have about the impacts that this has on Indigenous people. And of course, beyond racialized people and Indigenous people, we really want to think too about other dimensions of diversity because, of course, while this webinar focuses on racialized people with disabilities, people with mental health issues, people living alone, people with compromised immune systems, people having essential occupations, people who have lost their employment or have reduced hours, and other things, as some of you talked about, which is domestic violence, or the state of well-being of the young people. All of those are really compounding impacts in terms of what's happening in our Canadian society today. LGBT plus people, absolutely as well. Yes, many individuals are being affected in a significant way. So one of the things that we are seeing happening here is a growing number of organizations are calling for data on race because we're seeing these stories, these anecdotes, communities coming together. But there isn't anything systemic that is allowing us to use this data and to say, here's what's really happening on the ground. In the US, we have seen, and there's evidence that COVID-19 disproportionately affects Black communities. Right now, we have a lack of Indigenous data for those Indigenous people living off reserve. That has been one of the issues that have been highlighted in the news. We know also that the city of Montreal and Toronto is looking at collecting race-based data on COVID-19 cases because of the raised awareness brought on by community members about what's happening there. And the Public Health Agency of Canada also said that it is looking into the possibility of collecting race-based data on COVID-19, despite months of calls from advocates for a clearer picture of who's contracting the disease and how it affects them. And a growing number of community-based entities are now launching racism reporting systems. So a new network was developed in the last few weeks called Act to End Racism, and it's a pan-Asian anti-racism network across Canada. And actually, the founder of this network will also be joining us on May 28th to talk about what they're doing to support the Asian community around this topic. The CCNC in Toronto and CRAR in Montreal are two other organizations that are also doing a lot of great work to address the issue of lack of data and addressing and supporting individuals who are facing racism as a result of COVID-19. So there's a lot of movement happening on the ground and through the public institutions in terms of what are we doing, what are our focus areas, what information should be collecting, and what can we do to support, Canadians, Indigenous peoples, Asian Canadians in the face of this very difficult situation. And Dan Gallant, who's a former white supremacist in Canada and who is now no longer a white supremacist, is actually helping individuals to get out of the white supremacist network, had said, that right-wing extremism has always been here in Canada, and it's still here. It is not necessarily growing, he says, but what is growing is that it's becoming more okay to be openly racist, whereas people before would wait until the brown guy would leave the room, right? And when I read this comment from Dan, it really hit me because it's so true. We'd like to think that we live in a very safe society, and we are proud of our Multiculturalism Act and institutions, but the reality is that we still have, white supremacists amongst us, and we have to deal with that. And this COVID-19 actually has opened the Pandora box for some of them to be able to, demonstrate their racial superiority and attack individuals who are not like them. And when we talk about racism, I want to take a moment to also highlight the cycle of prejudice and bias, because oftentimes racism starts with somebody having a bias or a stereotype against someone. And that bias, which is sort of like they are, ... oftentimes leads to prejudice. And prejudice is as a result of this bias, these individuals can't do ... And as a result, the prejudice leads to actions, which are discrimination. And in discrimination, we won't ... So for every bias or stereotype, that leads to a prejudice, which leads to discrimination. And those then causes a reaction on both the victim, the person being impacted by the racist act, and on the offender, the person who is being racist. And so if I were to use the example that's in the media these days, that, Chinese people or Asian people are dirty, they eat bats and wildlife, and they cause disease, right? Oftentimes, this is what we've been hearing in the news. Then the prejudice can be here that as a result of that, Chinese people are to be avoided, that they can't be trusted. The discrimination then would be something along the lines of, because they are dirty and they can't be trusted and they are to be avoided, then some of my actions could be, I'm going to stay away from them. Or if I see them, I will tell them to go away. Or I might tell them to go back to China. Or maybe I would do something a little bit more subtle, like a smaller microaggression. I might want to cross the street to avoid them if I'm walking a little bit too close from them. I may keep a further distance from them. Maybe if I'm on the bus and I see them, I'm not going to be sitting next to them. Or I might be doing something a little bit more overt, and like what some of the people experience, I'm going to blame them and yell at them and attack them, right? So the reaction on the offender often is feeling justified, feeling that they're protecting themselves and their loved ones, feeling that they are the hero, feeling that justice is served. But on the victim, the impact can be multifaceted. It could be fear, anger, frustration, being misunderstood, having higher anxiety of leaving the house, leading to further isolation, and the physical and mental impact around safety. And another stereotype I think that I want to highlight in here, which is really important, is that oftentimes there's a stereotype that Asian women are submissive, timid, or easy to scare. And if you look at all of the attacks that have been happening in Canada because of COVID-19 towards Asians, interestingly, most of these attacks have actually been on Asian Canadian women. And in some cases, it has been on elders who can't defend themselves. And oftentimes, it is on social media because of the safety of individuals attacking people behind their computers. So victims oftentimes are also the ones who are the weakest that are being taken advantage of. And I think the cycle of prejudice is a great one for us to think about. And as soon as we start talking about a particular group of people, whether they are, Indigenous peoples or people from the LGBT plus community or, elderly people, for example, as soon as we say they are, then we want to catch ourselves and say, is there a bias that I have around this group of individuals, assuming that they all share that particular trait? And how do I stop this bias right there and then so that it doesn't become prejudice and it doesn't lead to discrimination? So this is an important cycle for us to sort of always keep top of mind for all dimensions of diversity. And within the context of COVID-19, I think it's also really important to think about our current context, the history of racism in Canada. And I've seen this comment being noted multiple times by you today in the chat box. So thank you so much for that. But let's face it, unfortunately, Canada has a long history of racism and discrimination. I won't have time to list all of the events here, but I'm going to highlight a couple of them, right? So first of all, with regards to the Indigenous people, we know about colonization and the detrimental impacts of colonization on Indigenous people, the establishment of residential schools, the 60 scoops, stealing babies away from their parents. All of those things were based on the assumption that Indigenous cultures and spiritual beliefs were inferior and unequal to the Western settlers, right? And indeed, some, sought to, quote unquote, kill the Indian in the child. And so today we recognize that this was really a policy of assimilation and that it was very wrong. But at the time, this is something that was completely acceptable. And when you look at the internment of Japanese Canadians, this is also another terrible mark on the history of Canada, where over 22,000 Japanese Canadians, which at the time comprised of over 90% of the total Japanese Canadian population from British Columbia, were evacuated and interned in the name of national security during World War II. And this happened in other parts of Canada as well. And this forced relocation subjected many Japanese Canadians to, government-enforced curfews, interrogations, loss of jobs, loss of properties, and in some cases, forced repatriation to Japan. And the irony of it is that many of these Japanese Canadians were born in Canada, have, for multiple generations as well. And so what to me is very frightening is there's a lot of similarity that's happening here with what's happening to Chinese and East Asian Canadians. Japanese Canadians at the time were blamed for the war caused by the people in Japan. Similarly, Chinese Canadians, or people who look Chinese, here now are being blamed for the coronavirus, which actually started in China, a foreign country. And many of the people here of Chinese background actually are born in Canada as well. right? So it's really a difficult situation that we're in right now. But we have to understand that this history of racism exists and is being continued to this day in Canada through this direct experience with COVID-19. The second one that I wanted to highlight is this model minority myth, right? And this myth really compounds the issue because it characterizes Asians as polite, law-abiding citizens who have achieved a higher level of success than the general population through some combination of innate talent or pull yourself up by your bootstraps efforts. And so it perpetuates this myth that Asians are all the same. It ignores individual differences. And there's actually a growing group of Canadians who have animosity towards Asian Canadians because of their apparent successes in education and professions, taking away jobs that should have been theirs. And this is very much tied to this concept of the yellow peril, this issue that China is intentionally damaging Canada and the rest of the world with COVID-19, right? These conspiracy theories that, the virus is man-made, that this is a complex scheme developed by China to take over the world, and a threat to Western living standards as well. So this is adding to this anti-Asian sentiment. And lastly, I want to also share about this culture of mask wearing. So of course, since SARS, a lot of Asian countries have welcomed and used on a regular basis masks. And as a collective society, wearing masks is not so much about protecting myself as it is about protecting others. So wearing masks in Asian countries is actually a badge of honor and societal responsibility. And yet when Asian people in Canada wear the mask, suddenly they are being seen as, the ones with the virus, the ones who need to be singled out and who feel unsafe and misunderstood. And in fact, I have a lot of Asian friends, and they often tell me that, I'm afraid to go to the Safeway or the Co-op or the Loblaws near my house, and instead, I feel like I need to go to the Asian grocery store so that I can wear my mask, feel safe in numbers, feel the safety in numbers, and not have to worry about offending people because I'm wearing a mask. So this is an interesting context that we live in with a mix of different factors, the history of racism, the model minority myth, the yellow peril, and this culture of mask making that, when looked together, really adds more challenges and difficulties for Asian Canadians to be accepted as who they are during this COVID pandemic. So what are some of the considerations for our workplaces here? Well, as a result of what's happening, the Canadian Human Rights Commission actually came up with this statement. I'd like to read that to you because I think this is something that is really important for us to know. The Canadian Human Rights Commission is deeply concerned by the rise of racism across Canada since the start of the COVID-19 pandemic. Minority groups, in particular people of Asian origin, have been the victims of racist taunts, threats, and intimidation in public and online, and physical violence. This is both an issue of public safety and fundamental human rights. No one should feel threatened or unwelcome because of the color of the skin or where they're from. Racism and xenophobia are also contributing to misinformation during a global health crisis. Viruses do not have borders. Viruses do not discriminate, but people do. Flattening the curve and slowing the spread of COVID-19 will take cooperation, solidarity, and unity. As a country built on diversity, freedom, and inclusion, we cannot let racism, intolerance, and inequality undermine our peace and prosperity. And we are not safe unless we are all safe. And they have expanded the human rights legislation to add a few additional points. And here is, and I went through the various provincial human rights pages, and this is pretty consistent as well from province to province. One is employers are prohibited from unreasonably discriminating against employees on the basis of characteristics protected by the code and related to COVID-19. Employers have a duty to reasonably accommodate employees in relation to COVID-19 unless it would amount to undue hardship. Employers should consider requests for accommodation in good faith, and employers should be flexible and consider not overburdening the healthcare system with requests for medical notes. So I hope that employers are really looking at these slight changes, but important changes to human rights legislation. And here are some possible accommodations as well that is being proposed. One is review your absenteeism policies to ensure that they do not negatively impact employees who cannot work due to COVID-19. Provide support in place so employees can work from home while in quarantine. And that could be support related to, for example, technology, right? So making sure that they've got the right computer, headset, and mic that would work for them, and providing them with training on how to work remotely. Touch-based calls to make sure that people are okay. Accommodate employees with caregiving responsibilities. Right? So are you able to set up some flex time during work hours for people who have to care of children, elders, or perhaps a family member who's self-isolating? And address other vulnerabilities like stigmatization, compromised immune health systems, and pre-existing conditions. Employers really can play a significant role in this issue today. And, for many of us who work 8 hours a day, sometimes more than that. And so we spend many hours of our waking life at work. I would encourage persons in positions of leadership to accept and publicly acknowledge the existence of racial profiling and demonstrate a willingness to undertake action to combat it. To recognize that while often displayed overtly, racism can also take on subtle, unconscious, or covered forms, which are those little microaggressions or micro-insults that I talked about. And replace all of the scaremongering right now that's happening with caremongering. Communities and people coming together to take care of each other, to sew masks, to deliver food for people who are self-isolated. We're seeing lots and lots of that in the community. And I would like to challenge you on how we can extend that caremongering to the workplace. And here are some ideas for your consideration. You can train HR and people managers on how to address people's concerns during the pandemic. You can perhaps provide a confidential line to report acts of bullying, racism, or other forms of discrimination. And when you are creating this reporting system, consider cultural competency in facilitation of the process as well as responding to the report. And look at your employee and family assistance program through a diversity and inclusion lens impacted by COVID-19. Do you have counselors who can, in fact, address the COVID-19 situation in a culturally competent way and who really understand what's happening right now across Canada? And finally, I have a couple of slides here for you about capacity building, because this is a great opportunity, if you haven't done so, to build greater capacity to address racism and discrimination in your workplace, both at the organizational level and the individual level. So the first one here is consider measuring your workforce if you are not already doing that. Right? Measuring your workforce is really the only way to generate evidence in a scientific way of possible barriers in your workplace. Things like race, gender, role, etc., to provide you with an ability to do intersectional analysis. You can also take a quick pulse of your employees today. How is COVID impacting them? How are they feeling? What are some of the things that you might be able to support them right here and now? Another capacity building tip is to protect workers by developing anti-racism and race equity workplace policies and training. For example, do you have a health equity plan in place? And is health equity plan being applied and adapted during COVID-19? Third one is about investing time and resources in race-focused D&I initiatives, right? So organizations need to have a budget to show effort and commitment to this work. And rewarding individuals and groups in the organizations that, in fact, are putting an effort on race-focused D&I initiatives. Look at partnering with specific racialized communities in and outside of the workplace. And if you had those partnerships in place today, they would have been actually a great point of contact to help your diverse workers who are being negatively impacted by COVID-19. Develop mentorship and sponsorship programs for racialized employees. So build capacities for your racialized employees to make a difference in your workplace. And through mentoring, but also sponsoring them so that they can take on more leadership roles. And finally, target anti-racism racial equity initiatives to address various forms of racism and stigma. So remember, what you permit, you promote. And at the individual level, I would encourage us to look at a few different things. So educate yourself on racism, the history of racism in Canada, how it's playing out in today's workplace, and mental health in Canada, and the barriers faced by racialized Canadians. And in the process, also reflect and assess your privilege. Secondly, listen to the experiences of racialized colleagues. What's really happening? Learn from them. From those posters that I shared earlier, build sympathy. Make the invisible visible and raise your awareness. 3, challenge racist and derogatory comments or behaviors espoused by your colleagues, clients, and others. A lot easier said than done. But if there's a way that you can do that and be safe, I think that it will create more space for racialized workers to feel like my colleagues have got my back. My workplace understands what I'm going through. So we encourage you to challenge these and to do it as much as possible, in a respectful way. And finally, participate in and promote race-focused D&I initiatives at your workplace. Practice caremongering and encourage victims of racism to report. Thank you very much. So my last question to you here, based on all of this content that I have shared with you, what is the one thing that you or your organization could do to support those faced with racism, stigma, and mental health issues due to COVID-19? All right. So listen and act. Absolutely, yes. Oftentimes people want to jump into acting, but listening is equally important to really make sure that we're acting in the most appropriate ways. Providing support, yes, providing support to each other, education, staff training to promote diversity. Keep the conversation going by listening first. Listening, absolutely, I love it. Providing education, showing empathy and understanding. Having stronger penalty for racism. Yes, because you don't want to condone it. And so being very clear, being very articulate about why racism is not acceptable, and having that zero tolerance, I think, is a very strong point to share. Standing in solidarity with racialized community. Absolutely. Thank you very much. You have great insight, and I'm very happy to see about some of the things that you've identified you will be doing as a result to support people faced with racism, stigma, and mental health. So I have some time now to entertain questions from participants. And before I do that, I just wanted to, again, highlight May 28th. We have a free webinar. I encourage you to sign up for this one. It's going to be basically part 2 of this webinar, where we're going to have a panel of community and workplace leaders who will share their experiences and insights on what they're doing to address the racism that's being experienced. So tune in for that. And to wrap up, the final quote, it is not our differences that divide us. It is our inability to recognize, accept, and celebrate those differences. So thanks so much. I know I spoke a whole lot. So now I look forward to any questions that you may have. And I'll pass it back to Mackenzie.
Awesome. Thank you so much, Anne-Marie, for the excellent and informative webinar. As Anne-Marie has noted, we do have time for a few quick questions. If we don't get to your question, please feel free to email us at events@ccdi.ca, and we'll get back to you as soon as possible with a thoughtful answer. With that, I will start with questions because we already have a few here. So Anne-Marie, our first question is, what are some legislative measures that penalize people who show workplace discrimination and racism?
Yeah. So, you know what? Depending on whether the workplace is federally legislated or provincially legislated, there are some common human rights legislation that could apply to them. And those are under the prohibited grounds or the protected grounds under human rights legislation, depending on whether it's provincial or federal. And so basically, employers are not to discriminate based on those protected and prohibited grounds, right? So that could be race, gender, marital status, disability. And so certainly within the context of COVID-19, you know, penalties can be financial penalties. It could be restitution of back pay, for example, or pay as a result of the suffering that the victims may have incurred. It could also be things such as requiring the workplace to develop training, to change their policies and practices, and to demonstrate evidence of change in the workplace that can be measured through things like employee surveys or feedback from affected employees. So there's really quite a range of penalties that can be put in place, both at the provincial and federal level for employers who are not supporting their diverse employees.
Awesome. Thank you. Thank you so much. Our next question is, someone is wondering why there seems to be an overly biased anti-racism, anti-Asian discrimination going on in Canada versus in the States you see a large push towards Black communities, and people are wondering why you aren't seeing those kinds of things happen to Italian demographics and stuff like that. Would you be able to speak towards that a little?
You know what? That's very interesting because actually I think it might depend on which news you listen to as well. And it's very true that in the US, there seems to be more conversations around, you know, anti-racism that is affecting more communities. So the Black community, the Hispanic community, you know, have been identified, as well as the Asian community. But I think oftentimes it comes from different angles. So when we see news around, you know, Black community or Hispanic community, it's more, you know, tied to the, you know, the social economic status, the lack of access to healthcare, the lower pay, the fragility of their current employment status, the use of public transit, inability to, you know, isolate and things like that. Whereas when we talked about racism targeted towards Asian Canadians, and Asian Canadians come at all socioeconomic level as well. And so you can be poor, you can be middle income, you can be, you know, high income, but you can still face the anti-racism because of the color of your skin. And I think that that particular scenario is playing out actually across Canada as it is playing out across the US. So I hope that that helps to unpack that a little bit, but I do believe that, you know, the color of the skin has an obvious impact across probably the world when it comes to anti-Asian sentiment.
Great, thank you. I'm just going to squeeze in one more question here, Anne-Marie, and that question is, what do you suggest when companies say they can't manage the investment to make these kinds of changes right now?
Well, you know, I can certainly relate to the difficult economic times that companies go through right now. So we cannot just ignore that and put it aside. It is the reality, and it causes a lot of stress for organizations. What I would suggest is a couple of things. One is, if you don't do anything, you are putting yourself at risk and liability for not providing the support and the accommodation required by law and of an inclusive employer to support your workers, right? And so that could lead to further complaints, further exclusion, lowering the reputation of your organization, and all kinds of other negative impacts. The other thing too is there are quite a number of things actually that organizations can do that doesn't cost money. You know, taking care of your employees on the ground, having regular touch base with them, and as many of you said earlier, really listening and having empathy and trying to understand what's going on in their world that you might be able to address as a caring, inclusive employer. So I think it's not one or the other. You know, you can certainly look at the variety of ways in which you can support this in the workplace, and some of those ways do not necessarily cost a lot of money.
Awesome. Thank you so much, Anne-Marie, for those very thoughtful answers to some great questions. We do have a few more questions coming in, but I'm sorry we are out of time for today. Just a quick reminder that our slide decks and recordings are not made available to the public after this, but if you are an employer partner, within 2 weeks, this webinar recording will be posted in your knowledge repository, so you will be able to see it then. Thank you, everyone, for your thoughtful comments and discussion points today, for your questions. We really appreciate it. We hope you're all staying safe and healthy and happy during these times. And remember, as things start to open up, please keep social distancing practices in mind and keep yourselves and your families and your colleagues safe. Thank you again for joining us. And thank you again, Anne-Marie, for your excellent webinar.
Thanks, Mackenzie, and thank you, everyone. Please take care of yourselves and have a great rest of
Thank you. We hope you enjoyed today's webinar. For more information on upcoming events, please visit our website at ccdi.ca.